Hello. Welcome to Considerations Prior to Evaluation of a Speech-Language Impairment under IDEA. My name is Angie Neal, and I'm the Speech-Language Pathology Consultant and Policy Advisor for Speech-Language Services and Early Literacy at the South Carolina State Department of Education, Office of Special Education Services. When a student is suspected of having a disability in any area and may be in need of special education and/or related services, the process begins with a referral to the school's problem-solving team. It's not a referral directly to the SLP because consideration for speech-language impairment is no different than consideration of any other category of disability under the IDEA, and as such must be treated the same way. So while the initial concerns may be for a specific area, such as speech-language impairment, the team is required to look at all areas, to review all areas, to discuss all areas by a team in order to look comprehensively at the student's strengths and needs. Again, this is a requirement of IDEA, and this is especially important if the concerns are in the area of language, as it would be highly unusual for a student to struggle in the area of language, but not also struggle with curricular instruction, including the area of reading, either now or in the near future. So students really should not be considered for disability-specific evaluations, speech-language impairment specifically. But again, we must look and review all data as opposed to only looking at one area, because this may in fact skew the evaluation and subsequently appropriate instructional programming. Upon a review of all of the pertinent data, the team, every member of the IEP team, must identify what the additional data is if needed in order to determine if they have a disability, what those educational needs are, and whether or not they need special education services. Now, even if the team member suspects the student may or may not qualify, that decision is still made by the team as a team. As such, all team members should have an understanding of determination of eligibility for a student with a disability under IDEA before making the referral. This will be explained a bit more in later slides. But it is up to each school and/or each district to provide training to all potential IEP team members, including general education teachers, regarding current standards for evaluation and eligibility determination as per state law. The federal law for both initial eligibility as well as ongoing eligibility includes the requirement that the child must meet one of the categories of disability as defined by IDEA. The disability must be in need of specially designed instruction, and importantly, the disability must adversely impact the child's educational performance. Or, if the child is in preschool, their educational impact refers to their ability to participate in age-appropriate activities. If all criteria are not met, the student is not considered a student with a disability and is not able to receive special education services or continued special education services under the IDEA. As a point of additional clarification, the purpose of specially designed instruction is to meet the unique needs of students with a disability, with an identified disability, in order to for that child to access in the general education curriculum, which means meeting the educational standards that apply to all children. Because if there's no data documenting that there's adverse educational impacts, difficulty accessing and progressing towards the educational standards, then what is the specially designed instruction there to support? For additional clarification for preschool, what is meant by appropriate activities for preschool-age children? Well, there are 5 domains of development, of early childhood development, according to the National Education Goals Panel. And that represents all the things that children need to know for academic readiness. And this is regardless of whether or not they are enrolled in a preschool or daycare program. Those domains include physical and motor development, social and emotional development, approaches to play and learning, which falls under the area of language, language development, and then also general knowledge or cognitive development. Now, the South Carolina Early Learning Standards identify and clearly lay out exactly the skills that are expected in terms of standards and indicators for each of those domains. And they do so by breaking them down into approximately 6 to 12 months intervals. So the indicators, what would be expected from birth to 12 months, 8 to 21 months, 18 to 36 months, so on and so forth. That is why the early learning standards can be a very helpful guide for gathering data to support participation in age-appropriate activities. The common denominator for consideration of a student as a student with a disability under the 13 categories of disability for IDEA is adversely affects educational performance. However, neither IDEA nor the Office of Special Education Programs nor the Office of Special Education Services, none of them define this concept because in a letter, or the operational definition is included in a letter to Lieberger, and it states that educational performance must be determined on an individual basis, and it should include both non-academic and academic skills. So again, that's why we say adverse educational impacts instead of adverse academic impacts. So teams need to be familiar with data that supports academic as well as functional or non-academic impacts. This is how suspicion of a disability under IDEA is very different than suspicion of a disability in any other setting. Specifically, if you think about it, insurance companies also have specific requirements for programs and services that are covered by their policies. And each insurance company has different requirements for what is and is not allowable. This is the same thing in the school setting. Programs and services provided in a school setting have specific requirements, and they are outlined by federal law, referred to as IDEA, as well as state law. But consistent across all settings, if that individual does not meet the requirements as outlined, whether it's through the insurance policy or state or federal law, that individual is at liberty to pursue those supports and services in other ways, in other settings, or via other funding sources. As a reminder, adverse educational impact requirements are outlined by IDEA, and they are necessary for both initial eligibility as well as ongoing eligibility. Is that student, do they still meet those prongs of eligibility every year? And data must be provided as part of each annual review that continues to outline the ongoing presence of a disability, that disability requires specially designed instruction, and there must be documentation that outlines and explains what the adverse educational impacts are as a result of the identified disability, and that it continues to impact their ability to access and progress towards the educational standards that apply to all students. The reason eligibility under IDEA is so important to consider and for teams to be aware of, all team members to be aware of, is because there are potential consequences of inappropriate eligibility determination. For example, if a child is identified as disabled, but they actually do not meet the federal and state definition of a disability and for special education, there can be negative impacts on the student, such as, for example, they may miss class time, or the teacher may inadvertently think the child is less capable. It's also a violation of civil rights to be called or considered someone as a disability who does not meet criteria for a disability. It would also be a violation of ethical standards of practice, could likely be considered a denial of a free and appropriate education, and it could be considered fraudulent receipt of state and federal funds if that student does not meet criteria to receive those state and federal funds. So going back to looking holistically, gathering all of the data before we begin the evaluation process, why consider all areas of suspected disability? Well, when we look holistically at the student, that helps us to identify any and all potential areas of disability. And in doing so, that helps us to provide appropriate supports in a timely manner. And it assists the provision of supports through a problem-solving process. So all of that to say, when we're looking at all of the potential areas of disability, that means we can go ahead and initiate either interventions or additional services immediately and not having to wait, for example, to place the student as speech language impaired one year and then the next year as specific learning disability. But again, we have to make sure that we're looking at all of the data and as well as thinking about the rule out factors as outlined by IDEA, which states that a child must not be considered or determined as having a disability if it's due to a lack of instruction in reading, including the essential components of reading instruction as defined by the Every Student Succeeds Act, which we'll talk about on the next slide, lack of appropriate instruction in math, or limited English proficiency. So the rule-out factors are important to consider because they align with federal laws for comprehensive literacy instruction in general education. In addition, they ensure that the student is not being considered for a disability simply because they have not been taught the information or exposed to the information. It also ensures that there's a team approach to intervention. In other words, if there are weaknesses identified in phonological awareness, vocabulary, language structures, and/or comprehension, that intervention through general education, again, through general education, can and should be provided. In other words, it is not automatically that intervention should be provided by the speech language pathologist, say, for example, in phonological awareness, because these are skills that should be taught as part of comprehensive literacy instruction in general education. The fact that these are areas of language, however, makes our collaboration with general education teachers and reading interventionists especially important and especially helpful for all students. So here are some things to think about when you're thinking about limited English proficiency. The team may want to look at what is the student's home language? What is the student's score or proficiency according to Access Assessment? What is the student's stage of language acquisition in another language? How much English does the student speak? Or what or how much do the family and caregivers speak other languages at home? And most importantly, is there a reason to suspect a disability in the native language? Because as we talk about assessment, you have to appreciate that in order for it to be determined as a disability, it has to be present in both or all languages, which is why students who are multilingual must be assessed in both or all languages. And also importantly, the team must include and collaborate with the multilingual teacher to help address all of these questions. In terms of lack of systematic and explicit instruction in those areas of reading, the team should consider, has core instruction provided systematic and explicit instruction as outlined? Has the student participated in reading intervention? If so, how were those specific areas of weakness identified? And is that intervention targeting those specific areas of weakness? Also, how long has the student participated in intervention? And is the student, quote unquote, making progress in the intervention, or is the intervention actually closing the gap? In other words, is the student catching up to same age peers? So also, how is the student's progress in comparison to those students in the intervention group, as well as those in the same class or grade level? Now let's talk about screening versus observation. IDEA specifically states the screening of a student by a teacher or specialist, that would be us, to determine appropriate instructional strategies. Appropriate instructional strategies for implementation of the curriculum or the ELA standards, that is not considered an evaluation for eligibility for special education. So, pass-fail findings, such as the student passed or the student has concerns in this area, those must not be used to determine which students do or do not go forward with an evaluation of a suspected disability, because these decisions are made by the team based on a variety of data. So to be very clear, the purpose of screening, using a screening tool, is to determine appropriate instructional strategies, and those strategies should be implemented within the general education setting. So a screening should not be used to determine whether or not that student should go forward with an evaluation, because that could be considered as determining eligibility without reviewing all of the potential data. So when input is sought from the SLP relative to concerns in the area of speech and language development, the SLP should be part of the problem-solving process. I'll say that again. When there are concerns, the SLP should be part of the problem-solving process, and the SLP should contribute information and expertise as part of reviewing the data, as part of gathering information regarding suspicion of a disability. However, in order to effectively contribute to the problem-solving process and discussion regarding the student, the SLP will have to have at least laid eyes on the student, observed them, and or even screened them, if appropriate, prior to the problem-solving meeting. To clarify, there are two types of observations. The first is just a quick check of development. This quick check of development is usually when the teacher says, I'm really not sure if the student is where they should be for their age or not. This type of consultation with the teacher is considered an embedded part of the general education program. So permission for this type of observation is not required under IDEA. Your district may have different requirements, but it is not required under IDEA. The second type of observation is when it's part of the evaluation process. So wherein the purpose is to document those functional impacts of a documented or suspected disability. And in this case, parental permission is obtained and must be obtained because it's part of obtaining permission to evaluate. There are also two types of screening. The first, as outlined by IDEA, is to determine appropriate instructional strategies. So again, parental permission to support instructional strategies in general education, that is not required under IDEA, though your district may have different requirements. Now, this type of screening serves to pinpoint which areas of speech and language may warrant intervention or instructional strategy supports. It may also identify the type of intervention and/or supports, as well as potential methods for providing the intervention and support. So observations are very general, getting a general idea, but screenings really are looking more specifically with the purpose of outlining instructional strategies for general education. A second type of screening is a screening that's part of the early childhood program. Now, this is when a parent or a family member brings a child for child find. And so when they are bringing their child for child find, parental consent is not required under IDEA, although it may differ for your district specifically, but it's not required under IDEA because the parent has knowingly and willfully brought their child to the child finding screening clinic for that exact purpose. Now, this type of screening is different because it's conducted within the early childhood program. And again, family member was referred or asked to begin pursuing this in order to get additional information about a child's development. Now, sometimes there's confusion about when we talk about early childhood program. Does this include kindergarten? Well, school-wide kindergarten screenings, such as universal screenings, or even if you did a school-wide speech-language screening, that would be considered part of the general education program, and as such, parental permission is not required under IDEA. Now let's talk specifically about screening tools. In general education, Every Student Succeeds Act, or ESSA, refers to the use of age-appropriate, valid, and reliable diagnostic assessments, formative assessments, and processes to identify a child's learning needs and to inform instruction. This is mirrored in IDEA that refers to assessments that are valid and reliable and provide relevant information to assist persons in determining the educational needs. So both federal laws, ESSA and IDEA, require the use of valid and reliable tools. Now let's do a bit of comparison. So universal screeners are something that you're very familiar with. Under state law, every student in kindergarten and first grade must be administered a universal screener 3 times a year. The purpose of a universal screener is to determine which students are at risk. A universal screener is a brief, standardized assessment, and it's specific to key literacy skills, and it's administered to every student. And it's conducted at the beginning, middle, and end of the year. Now, as an analogy comparison, universal screeners are similar to blood pressure or temperature checks because they identify if maybe there's a problem. And there's some examples there below. Now let's compare this to other diagnostic tools. Other diagnostic tools identify what skills does the student have, which ones are they missing and they need to be taught. Diagnostic tools are often unstandardized, and diagnostic tools are often administered to those students who've already been identified as being at risk, and they are designed specifically for the problem-solving process so that we can provide differentiated instruction or intervention. Now, here's your analogy. Blood tests or diagnostic imaging. They identify exactly what is the problem and what do we need to do. So some examples of some diagnostic tools that are not universal screeners are those that are listed at the bottom. Now let's consider diagnostic tools specific for speech and language. What they do is they look at which specific speech or language skills has the student mastered or not mastered along the developmental continuum. These diagnostic tools may or may not be standardized, but they are specifically for students who are suspected of a speech-language impairment, and they are specifically designed for that problem-solving process, again, in order to provide differentiated instruction or intervention. And again, it identifies what is the problem and what do we need to do about it. Now, the difference, though, is diagnostic tools looking specifically at language and suspicion of a developmental language disorder, these do not always have to be administered by a speech-language pathologist. Think back to what we outlined with the Every Student Succeeds Act and what those rule-out factors are. Phonological awareness, phonics, vocabulary, fluency, and comprehension. So again, what are those areas of language? That's where we overlap. And that's why SLPs may not necessarily need to administer language-related diagnostic tools. Let me explain some of these. So here are a few screening tools that can be administered by an SLP or by educators. The first is an app. It's called Language Screen, and it's out of Oxford University. So it can be individually administered, because it's an app, to children ages 3 to 11, and it takes less than 10 minutes to complete. So it can be administered by the teacher or even the teacher's aide, and it reliably identifies children in need of support with language development. It's as valid and reliable as a 30-minute standardized assessment of language by an SLP. There are also whole classroom screening tools, so a universal screening tool for K through 2nd, and it can identify children at risk for language impairment and future reading comprehension difficulties with appropriate levels of sensitivity and specificity. The NLM Cubed, as you see linked here, it assesses pre-K through 8th grade students' ability to understand and use both oral and written language. And as an added benefit, it can be used for benchmark screening, progress monitoring, and intervention planning. This is a great tool that you may have heard me mention for SLPs to use as part of the evaluation process for suspected disability in the area of language. And it has strong diagnostic accuracy or sensitivity and specificity. The NLM Cubed and the Pearl also connect directly to specific intervention programs. The Pearl, however, is pre-K through kindergarten. It is a screener for dyslexia and language disorders. And again, it accurately and reliably predicts which students will struggle with decoding and/or comprehension well before they learn how to read. And again, just like the NLM Cubed, it's a great tool for SLPs to use as part of the evaluation process for suspected disability, and it has great diagnostic accuracy. There is a great deal of research that supports screenings by non-speech language pathologists in the area of language. And the reason is because many of the universal screening tools that we have now, again, universal screening tools, they're really not as sensitive to word recognition difficulties as you may think related to dyslexia, but most of them, or even fewer of them, are sensitive to language comprehension in particular. And both oral language, complex oral language, plus phonological awareness. So complex oral language, including grammar, the ability to define words and listening comprehension, plus phonological awareness, those were found to play a predictive role in later literacy achievement when you measure them in 1st or 2nd grade, not when you measure them in kindergarten. Why is that? Because the expectations are different, and because we're also in younger grades looking more at decoding than that language comprehension ability. But interventions that improve language skills also improve reading comprehension. There's a great free access article by Adloff and Hogan called "If We Don't Look, We Won't See." And what they outline is the fact that most of our late emerging poor readers, they've been showing poor oral language weaknesses in kindergarten through 2nd grade. But we've not identified those weaknesses. But if those oral language weaknesses had been identified and addressed earlier, it's possible that those negative impacts on reading development could have either been prevented or reduced. And so this really makes that connection to the fact that identification paves the way for treatment. But again, if we don't look, we won't see. So we really need our schools to increase their attention to oral language foundations, oral language development, particularly within MTSS or response to intervention frameworks, because the goal of MTSS is preventing learning disabilities by identifying and intervening at early stages. That said, screening by someone other than a speech-language pathologist doesn't negate our collaboration or collaboration with the speech-language pathologist, because one of the greatest benefits of public education is the fact that there are experts in many different areas all in the same building at the same time as the student. So this should provide ideal opportunities for collaboration. And general and special education teachers have some of the greatest opportunities to accelerate language comprehension development because students are exposed to the most language during content area instruction. But our role as speech-language pathologists are to help identify and provide the research, the evidence-based supports for those language-related weaknesses. So here are some non-standardized screening tasks. These are non-standardized screening tasks that the speech-language pathologist could do. Now, to be very clear, we no longer use the term informal. Everything we do as diagnosticians, whether it's evaluation, screening, or even observation, it's a skilled service that requires expertise. So nothing that we do is informal. We have standardized tools and we have non-standardized tools. So non-standardized screening types of tasks could include having students retell stories or answer questions about familiar stories, doing sentence repetition tasks, even listening for speech sound errors when they do so, answering questions about sentences that are complex in their syntactic forms, using targeted vocabulary words in a sentence, explaining word meanings, my favorite one being, tell me 4 things about common objects. Also blending and segmenting tasks, such as say cat, but break it apart into the individual sounds, k, at, or you give them a word broken apart, such as block, b, l, a, k, and they have to tell you what the word is. And then also following directions with complex syntax, complex grammar, or complex vocabulary, all of which are supported by the research. All of those skills are supported by the research as you see listed below. And there are a variety of standardized screening tool options for speech-language pathologists. Now remember, if you're using a standardized screening tool, it does need to have diagnostic accuracy as outlined in the manual. If the standardized tool does not have appropriate diagnostic accuracy, it can still be used, just don't include the score. Here's a sample or some examples of some standardized screening tools for speech-language pathologists. We have the Clinical Evaluation of Language Fundamentals Screening Test. That's for students ages 5 to 21. It takes about 15 minutes, and it's got adequate sensitivity and specificity. There's also the Student Language Scale Screener for language and literacy, and that's for ages 6 to 18. It takes about 3 minutes, and it also has adequate sensitivity and specificity. Now let's run through about 7 different scenarios related to screening and observation to make sure that there's clarity on all of the information that's been provided. In scenario number 1, we have a school staff member who's really not sure if the student has appropriate speech-language development. So in this situation, a disability is not suspected, is not yet suspected. They just don't know. They just want to consult and find out more from you in terms of speech and language development. So in this scenario, again, you're going to be providing information and expertise as a general support to support general education. So this does not require parental permission under IDEA, though again, your district may have different requirements. There is a sample form. It's called the Teacher Referral for Observation by the Speech-Language Pathologist. This form helps document exactly what the concerns are and then starts a paper trail as necessary. Now, if the identified concerns are developmentally appropriate, meaning the concerns are well within the range of appropriate development based on their age, then what we should do with that information is we should also make sure to share what those concerns are, how they fall within appropriate age ranges, what those age ranges are, answer any of those additional questions by the teacher, and provide consultative supports and strategies. Continuing on, if those identified concerns are not developmentally appropriate, meaning those areas of concern should have been developed based on the student's age, then the SLP should make sure to observe the student and inquire as to whether or not these concerns are adversely impacting the student in the general education environment and their ability to access and progress towards the educational standards that apply to all students. Now, if there are adverse educational concerns, then the process must be started to refer the student to the same problem-solving team as would be referred for any suspicion of disability in any category of disability. And these are different across schools and across districts. Now, if there are not adverse educational concerns, the SLP may consider further screening. So they might want to do a more specific screening looking for those specific areas of need after obtaining parental permission to determine instructional strategies or interventions to be implemented within general education. Scenario number 2. Now there's a school staff member who definitely suspects there's a disability. Now, when there's suspicion of a disability, that includes suspicion that there are adverse educational impacts. So in this scenario, this teacher should initiate the process immediately to the problem-solving team because whether or not it is a speech-language impairment or specific learning disability, IDEA requires that we do not delay or deny access to appropriate evaluations when there is a suspected disability. Now, parental permission for observation is obtained. And now, because we've obtained permission for observation and we're pulling the student out, that's the big key factor when you're looking at parental permission. Are you isolating the student, pulling the student out, doing something different for that student than would be done for any other student? Those are the situations that really need parental permission. However, what we're looking at now is when we're looking at observation now instead of screening, because we're going into observation to look and see, gather a little bit of preliminary information first as part of the problem-solving process. As part of the problem-solving process, we may later want to do a screening to develop more get more instructional information in terms of specific weaknesses and needs. But this is a big key change. Because we are starting with observation, this eliminates conducting a screening where the screening results form has pass, fail, or yes, there's identified areas here, there, everywhere. It eliminates that documentation. So there's a new screening results form. But also, there's a sample observation result and recommendation form that you can complete and helps really sort of streamline what the observation is looking at. But an observation by the SLP should take place before the problem-solving team meeting and have the SLP attend that problem-solving meeting in order to review all of the data and to be part of the problem-solving and decision-making process. In other words, does the student have a suspected disability that would warrant the speech-language being involved, speech-language pathologist being involved, or not to the level of a disability, but we want to provide a screening in order to look more closely at instructional strategies that could be implemented. Now, if the concern is specific to speech-language impairment, there's a sample form called the Educational Assessment of Speech-Language Skills. This form that is completed by the teacher is very helpful in providing data to support that adverse educational impact. But for the SLP, those observations of the student, we really need to consider when we're doing those. We need to look at what is the learning environment. We need to look at them in the regular classroom setting. We need to look at the functional impacts. And again, look also at those observation results and recommendation forms. But we really need to be looking at the functional impacts. What does this look like in the actual classroom? And finally, we need to consider that different areas of speech-language impairment require different types of observation data. So for voice, we need to be looking at two different observations, one of high vocal demand and one of low vocal demand. For fluency, we need two or more observations in different locations, not by different people necessarily, but we also, if the student is a multilingual speaker, we need to determine if there are dysfluency issues in both or all languages spoken. Remember, presence of a disability in a multilingual speaker is when there are concerns in both or all languages. And then for speech sound production, we need to look at functional impacts. Look at intelligibility. What does this look like in terms of the student's reading or writing abilities? In terms of language, we need to look again at those functional impacts, that student's ability to participate in the classroom, what the student's performance is like in comparison to their same age peers, same grade peers, same classroom peers, especially in the areas of reading and writing. And then for preschool, we need to be observing functional impacts relative to those early learning standards and domains, specifically the domains of play, learning, language and communication, as well as emotional and social development. Our next scenario is when there's a parent referral for suspicion of a disability under IDEA. And federal law IDEA includes allowances for a parent to request an initial evaluation at any time to determine if that student has a disability. So if a parent expresses concern regarding a potential area of suspected disability, any area of disability, under federal law, the problem-solving team must assemble and discuss those concerns in a timely manner. The result of that discussion could be a screening. And remember, the purpose of the screening is to provide appropriate instructional strategies within the general education setting, but that could also mean providing information to the parent about things that they could be doing at home. That could also mean a screening, an observation, or intervention before or in order to determine if there's suspicion of a disability. So, or that intervention could even be part of the evaluation process. Or the team could decide to proceed with the evaluation if those concerns rise to the level of a disability under IDEA, and that also means that there's suspected adverse educational impacts. Now, to help explain those differences between school-based speech therapy services and other settings, there's also a handout for you that you'll find the link to at the end of this document entitled Information Regarding IDEA and Eligibility for Speech Language Impairment. There's also the provision of a home program that is available for you. So it's a series of home programs that are available to share with parents regarding speech sound development and how they can encourage that at home. In this next scenario, we're talking about child finds specific to preschool. Now, in this scenario, there are concerns about the development of a preschool age child, and a screening and or observation is warranted. So keep in mind that a comprehensive screening tool is only one piece of data used to ensure that developmental milestones have been achieved in accordance with age-appropriate expectations. But this one piece of data may not be used as a determination of eligibility and or whether or not to go forward with an evaluation of a suspected disability, because that is a team decision. It's a team decision based on multiple pieces of data, not based on one piece of data, not based just on the dial or just one piece of one screening tool. So observations using a criterion reference tool, that is actually an additional piece of data that may help identify where the student falls in comparison to age-appropriate development, and that observation may help pinpoint specific skills, especially in a functional environment when you're looking at them in relation to play. So again, there's a sample preschool observation form that's available for you. Now, regardless of whether this preschool age student has been observed or they've been given a formal screening measure, this is not, again, it's not a comprehensive evaluation, so additional information is needed in order to determine if the child is suspected of a disability. Now, that additional information may include, but is not limited to, intervention data, which we'll get into next. It may include health and developmental information. It may include parent input. And again, there's a preschool parent checklist provided for you to help gather that information. It may also include other types of data in order to determine if they are suspected of having a disability. So preschool and intervention. There's nothing in federal law that prohibits utilization of an intervention model for preschool age students. Intervention for preschool age students is best provided, in fact, within the preschool environment. In doing so, what it does is it maximizes the generalization of those targeted skills, as well as consistent language being used across all of the adults in the preschool environment. So it is strongly suggested that intervention for preschool age students also include parent training and having that as a component of the support. Now let's talk about another scenario, which is the transition from Part C, or BabyNet, to Part B for IDEA eligibility. Now in this scenario, a referral must take place within at least 90 calendar days prior to the child's 3rd birthday. Now, a screening tool again, in this scenario, cannot be used to determine eligibility for Part B services. I'm going to say that again. Screening tools may not be used to determine eligibility for Part B services because, again, IDEA requires a variety of assessment tools and strategies to gather 3 types of data: functional, developmental, and academic information, including whether or not the child is a student with a disability and the content of an IEP. And a screening tool does not gather those 3 pieces of information for those 2 purposes. So again, what you're going to see here in green are some references to some support documents that are linked or embedded at the end of this presentation that will provide you more information about that transition from C to B. Now let's talk about a Head Start referral. Well, in this scenario, the LEA or the district has received a referral from Head Start. Head Start completes a developmental screening for every single child to identify developmental concerns within the first 45 calendar days of when the student first attends Head Start. Now, if there is suspicion of a disability under IDEA, and remember, that's the disability that needs specially designed instruction because there's adverse educational impacts, then Head Start obtains parental consent to share these needs that have been identified, and by making the referral to the LEA or to the district. The LEA or the district should also be very sure to provide training to the Head Start agencies regarding what are appropriate referrals for suspicion of a disability, in addition to some appropriate intervention strategies. Because again, as we mentioned, there's nothing in IDEA that says intervention when a disability is not suspected, but maybe perhaps a delay, that intervention strategies can't be provided. They can. So once the LEA receives the referral from Head Start, the LEA is not required to complete additional screening. One more time, that's important. The LEA does not have to do an additional screening before convening a referral planning meeting. However, it is recommended that the LEA or someone on that problem-solving team observe the child in Head Start classrooms in order to have a general knowledge regarding that student and their abilities. There's also, again, a link later on in the document referring to Head Start guidance. And finally, as it relates to Head Start, the LEA must process the referral, all of those referrals that meet the level of suspicion of a disability under IDEA from Head Start according to LEA, state, and district policies and procedures in order to determine or to ensure that all students are identified, located, and evaluated in a timely fashion. Now again, the outcome of these referral planning meetings could be there is suspicion of a disability, there is a recommendation for an evaluation, or the team does not suspect a disability, but they may recommend intervention, and those would be completed in the Head Start general education program. And if those interventions are recommended, the team needs to determine what the interventions are, who is going to provide them, how they will be monitored, and then most importantly, when is the team going to meet again in order to review the data about how the student has responded to the intervention. Or there is no suspicion of a disability, and so no further action is warranted. In scenario number 7, the student may or may not have passed hearing or vision screening. Well, hearing or vision screenings cannot be used to delay or deny an evaluation when a disability is suspected. So for example, if a student for whatever reason does not pass a hearing and or vision screening, it is up to the school and or the district to do everything within its power to support that family or caregiver in obtaining that formal vision and or hearing screening within the 60-day evaluation timeline. In other words, we do not need to delay or deny access to a full and individual comprehensive evaluation simply because it may take however long to get a more formal hearing screening. We must do everything in our power to make sure that is provided in a timely fashion. There is an updated hearing and vision screening results form. This is, again, something that districts can use to provide current documentation and that goes along with current guidance regarding hearing and vision screenings. Now let's talk about interventions. As stated before, intervention strategies cannot be used to delay or deny the provision of a full and individual evaluation pursuant to federal law when a child is suspected of having a disability. So as such, intervention prior to an evaluation is not required when there is clear suspicion of a disability that meets those prongs of eligibility as outlined by IDEA. I'll say that one more time. Intervention prior to an evaluation is not required when there's clear suspicion of a disability. And this applies to both intervention by SLP as well as a reading interventionist. So when might intervention be warranted? Well, intervention may be warranted if there is not clear suspicion of a disability under IDEA, and or the team may need additional data, additional information in order for the team to determine if there is suspicion of a disability. That said, intervention must be provided for a very defined period of time. This is typically 6 to 8 weeks. In other words, 6 to 8 weeks is enough time to gather enough data to determine whether or not the student is closing the gap. But this may vary based on individual needs. For example, if there are emotional or behavioral concerns, that intervention could be a week to 2 weeks. It just depends on the need and the intervention program. Intervention should then be reviewed with the team to determine next steps. And a very specific date should be set in order for that to occur. Now, an explanation of participation in direct intervention should be made clear to parents and all other school staff. In doing so, this avoids any confusion about whether or not the student is getting intervention in general education or special education services. And parent permission must be obtained if the student is removed from general education in order to get intervention support by an SLP if appropriate. Some of the things you may want to consider regarding intervention, especially for speech sound production. It may include, remember, again, intervention is not required when you suspect a disability. So we want to consider, is the student stimulable for the error phonemes? How many phonemes are errors? Which phonemes are in errors? So for example, if the student demonstrates one sound error, indirect intervention through teacher or parent training, that may be appropriate. But if there are 2 or more phonemes and the student is not stimulable for production of these error phonemes, you may want to start with direct intervention, especially if there's no adverse educational impact suspected. And again, provide these interventions for a period of time, review progress, and then determine next steps. As mentioned earlier in reference to ESSA, the role of the SLP in intervention is very specific. The role of the SLP is not as a primary instructor when those services and skills and supports should have been provided in general education. But we can be a resource for schools and at times be an interventionist when appropriate. So intervention by a speech-language pathologist should not supplant explicit and systematic instruction in general education through those programs and supports in those essential components of reading instruction as defined both by Every Student Succeeds Act as well as South Carolina's Read to Succeed law. Speech-language pathologists most definitely can provide valuable assistance to the general education personnel through professional development, through consultation, through demonstrating model lessons, through sharing materials and resources, through participation on problem-solving teams and reviewing data and providing recommendations, as well as providing direct intervention when more intensive or after more intensive interventions have been provided as it's appropriate, or as part of the data gathering process for suspicion of a disability. But again, we need to make sure that these are for defined periods of time and so that they are not looked at or considered as special education. So if direct intervention is provided by the SLP, it may be discontinued after a defined period of time, such as 6 to 8 weeks, with discontinuation having provided both teacher information as well as parent family caregiver training and recommendations. A few key points. Intervention is not required prior to evaluation when there's a suspected disability. Intervention is or must be matched to the needs of the student. Every student of every age can go through the MTSS or problem-solving framework. Intervention cannot be used to delay or deny access to an appropriate, comprehensive, individualized evaluation. MTSS is different from what we used to consider as RTI because the focus now is on prevention in general education through core instruction. Intervention should be part of a data-based problem-solving model, and intervention by the SLP should not supplant explicit and systematic instruction through general education programs and supports, again, related to those components of reading instruction as outlined by ESSA and South Carolina's Read to Succeed law. And finally, as mentioned, here are some support documents and forms that may be useful. There's the 2024 Hearing and Vision Screening Results Form, Home Programs for Speech Sound Development, a one-page parent information sheet about IDEA and eligibility for speech language impairment. There's a sample observation result and recommendations form, preschool observation form, preschool parent referral checklist, teacher referral for observation by the SLP, and the teacher referral for suspicion of a disability. Again, the form that documents the adverse educational impact. There's also specific preschool related guidance, IDEA Part C to B transition requirements, C to B guidance letter, transition training, and Head Start guidance. And these guidance documents also can be found on the SCDE website. Your attendance and for what you do every single day for students. I look forward to sharing more information with you in the future in order to ensure that our evaluation and eligibility determination for students suspected of a disability and those with a disability is as clear as possible. Thank you.